Hey guys, welcome to the channel. So today I am going to talk about the penis pump. And again, we do a lot of sexual wellness and men's sexual wellness. So if you end up liking what you see and the content that we're putting out, then please like and subscribe and share with friends. So today we're going to talk about the penis pump. Again, this is the Kaplan penis pump, and it's called actually the Whopper. Essentially, we have no affiliation with Kaplan. It's just that I happen to use this pump with our patients in a comprehensive sexual wellness treatment plan, mainly because it comes with 2 cylinders and there isn't a way to really increase the length of the penis. And if there is, the 2 ways potentially would be with a surgery where they cut the suspensory ligament, and you don't really want to do that, and most men don't want to go to that extreme. So the only other potential for increasing length would potentially be using the 2nd cylinder with this pump. And I'm sure there's other pumps because there's lots of pumps out there, but with this pump, if you use the 2nd cylinder, it includes the scrotum and the suspensory ligament, so potentially you could get stretching and length improvement. Why do we use the penis pump? You can use it for sex. And so you can put rings on that keep the blood flow in once you pump to an erection, and then actually keep the ring on the penis and have sex. And that would be after you pump with the 1st cylinder. And you can also use it for Peyronie's disease. So if you have a little curvature, we'll talk about that more at the end. And also just for potential size and function. With the Kaplan pump, and again, there's lots of penis pumps online. And so if you go online or you go onto a male forum, you will hear all kinds of different pumps. It is, a preference of a man, which one he likes. And this one is a manual pumping. And there's electric ones, and so there's different cylinders, there's different quality according to the men online. So again, it's preference. But this one has 2 cylinders. Each box, each pump that you get with this particular Kaplan pump system has 2 cylinders. This 1st cylinder is size related. So basically it's small, medium, or large. This one is the small one. So this is the small pump, and it comes with the 2nd cylinder, which is phase 2, and we'll talk about that. If you ended up with a medium pump, you would have a different circumference, but you would still get the size one that is used for erections and would be used for sex and size. This 2nd cylinder comes with each of them. So if you get a small, a medium, or a large, you get the sized 1st cylinder, and then the 2nd cylinder comes with all of them, and it's the same size. And again, this 2nd cylinder or phase 2 only needs to be used if you potentially want to try to improve length. And again, there's no studies to support that. It's just theory. But if that's something you're looking for, this has a 2nd cylinder, so you could try it. If you're interested in regeneration, rehabilitation after prostate surgery, sex, again, increased function or size, circumference, then you're talking about just using phase 1 or the 1st cylinder, which is the phase 1 cylinder, which is the size one. So basically you come with the cylinders, 2 cylinders. You're going to come with a handle that has a pressure gauge. You're going to have this tubing, which actually comes separate from it. I'm not even going to undo it, but it basically connects here. And then you're going to take the 2nd end, and you're basically going to attach it. And I just move it here. Got to press that button in very well, and then you'll hear it snap into place, which it did. Then you are going to go ahead and pump using this manual, and there's all kinds of different pumps. There's an electric pump, there may be even be hydro, but usually I'm thinking electric or manual. And basically you're going to pump this up. So there is a pressure gauge here, and again, what you're going to do, and I'm going to move this large cylinder out of the way for a moment, is you're going to look at the pressure reading, and you're not going to go above 10. You're going to do it to an erection, and it needs to be comfortable. Never above 10, but it may be a lower number for you to an erection and not uncomfortable. You can pump if you're using aspirin or Coumadin. That's okay. You just don't want to, dangerous here. You just don't want to basically you don't want it to be painful because you don't want to get bruising. You could potentially rupture a vein on the top, get some bruising, and you don't want that. So you just want to go to lesser degrees, maybe not as frequent as well. And again, all of our sexual wellness patients have basically a schedule. Like we have them on a schedule of pumping for regeneration while we're doing their sexual wellness treatment. So if you haven't seen our P-shot video, that's something that we do as part of our sexual wellness. Check that out. And if you haven't seen the Gains Wave, you can check that out. And then we do have another video about penis pumps as well that basically will talk about studies and again, it's used for rehabilitation after prostate surgery and the most common device that's used for that after. If you're talking about sex, then you would want to use these rings, and they come in the kit. And you can also use other constriction devices that you may prefer. And again, those are, cock rings of various, sizes, shapes, but you definitely want to make sure that you can get this off, because if ever you had a constriction device that you could not easily remove and you had a medical emergency, that would be an issue. So basically, you are going to, when you're pumping as well, which we haven't included, so you attach it and then you're going to put lube on the glands or the head of the penis, and you're going to put it in the cylinder, and then you're going to put this down onto the penis, and you're going to form a seal at the base of the penis and at the pelvic floor or abdominal wall. And essentially you want a strict seal, because when you start to pump, you want the pressure to be inside the cylinder so that it's actually pulling pressure and increasing blood flow to the penis. So you're going to pump to the erection, nothing more than 10, and it can be less than that. And then you want it there for at least 10 minutes. So again, if it's painful, don't do it as long, so you're going to do it based on your needs. But usually we would say, pump to an erection, and you're going to maintain that erection for about 10 minutes. And so again, if you want to have sex after, and there are studies on our penis video, and there are studies that this, again, vacuum erection device or VED is used after prostate surgery, and quite satisfactory for both the patient and the partner. For sex, you want to put this on the outside of the cylinder. And then once you get pumped up to an erection, you've done your 10 minutes, you want to have sex, or you're just pumping to an erection and you want to have sex, then you're going to put this onto the penis so that it maintains that blood flow in the penis, maintains the erection. And men and patients are quite satisfied with erections and sex and completion of sex with pumping and post prostatectomy or prostate surgery. I am going to press this little button, because again, that's the release, and it's going to release this tubing just so it doesn't flop all over the place, because it's been doing that. And so basically, if you are using the second cylinder, and that is if you choose to have potential length improvement, and again, no studies, it's just a theory, but you'll get onto forums and you'll hear men talk, and they'll give you feedback of whether that works, whether they think it works. And if that's something that's very important to you, at least know this is an option. But then you would want to use this constriction device. And this goes around the penis and the scrotum so that you can maintain that blood flow into the penis. So basically you would, use the snap that works for you. So that is basically the penis pump. Again, this is the main one used, and this is based on size, and this depends on whether you're going to have sex, you're going to use the constriction ring, you're going to maintain the constriction ring on the penis so that you can have sex. And again, we have the vacuum erection device and rehabilitation even after prostate surgery, and studies and details of that. And you can see the video for further details on that. But you can also use this for Peyronie's. And so if you look at Peyronie's, you can inject into the penis to get a breakdown of the collagen and potentially the scar tissue. But that is not very effective, and most are unhappy with that. And it's, again, not a preferred treatment for Peyronie's. So really the only thing, in my opinion, that treats Peyronie's is vacuum erection devices, P-shot, and acoustic shockwave treatments. And so those are videos that you can watch. And basically, they will talk about that, but that's how that improves that scar tissue. And Peyronie's disease is something that is progressive, and so it does end up in erectile dysfunction over time. So the sooner that you see or recognize a curvature in the penis, which is what Peyronie's is, that's a scar tissue. And so that you want to get at with something that can regenerate and can basically realign that collagen in a good fashion so that that scar is improved. And then you get straightening of the penis and less sex or less pain for the partner, and then less pain for the patient, but also less risk of erectile dysfunction as Peyronie's progresses. And again, the other thing is potential size. So hopefully this helps. This is the penis pump. This is just one overview of, or an overview of one penis pump, but the concept is the same. And I would love to hear your feedback. I would love to hear the pumps that you're familiar with and that you prefer. And other men would love to hear that too. So please leave your comments, like, subscribe. And again, we're willing to deep dive into anything sexual wellness. Thank you.